I'm Natalie, and this is my patient today, and we're going to be locating 4 pulse locations. So the first one we're going to be locating is the carotid pulse, and by locating this, you're going to find the trachea, and you're going to use 2 fingers, and you're going to go into the groove, which is like right next to the trachea. And right here in this groove is where you'll feel the pulse. So I'm just going to make a mark. Okay, so that's the carotid pulse. Next, we're going to find the brachial pulse, and this is going to be in the medial side of their arm. So this is the halfway point from lateral to medial, and in the medial, you're going to take half of that and come in between. And right here is where you feel the brachial pulse. And again, you're going to use 2 fingers. Okay, next we're going to find the radial pulse, which is closest to the radial bone, which is kind of where the palm of their thumb ends. So right here with 2 fingers, you're going to feel the radial pulse. And I'm going to make a spot right there. So next, I'm going to take her resting heart rate, calculating beats per minute at her radial pulse. So I'm going to take my 2 fingers and I'm going to count for 15 seconds and multiply whatever number I get by 4. So we're going to start. Okay, so 21, multiply that by 4 and I get 84. So 84 beats per minute, which is a normal resting. Okay, so I'm going to find the dorsal pedal pulse now. So what you're going to do is you're going to extend your big toe up, and this tendon is going to pop up. So this is the extensor hallucis longus tendon, and I'm going to feel it, and I'm going to come slightly towards the left side, and that's where I mark the spot. So now we're going to do the patellar tendon reflex test, and if you don't have a reflex hammer, you can use a pair of scissors. And what we're going to do is find the patella, and right beneath it, you're going to feel that tendon. It's kind of like a softer spot, and that's where you're going to try to aim to hit. So ready? I'm just going to do the swinging motion. Okay, good. So now you're going to have your patient laying down so that we can do the babinski reflex test. This is also known as plantar reflex test. So this, you can use a spoon. At the end of the spoon, you can use that and start from the lateral part of the foot and kind of with some pressure go up and then make a curve. Good. So the next thing what we're gonna do is count respiration rate. And usually for this, you don't actually want to tell the patient that you're gonna take their respiration rate, because then they'll start altering the way that they're breathing. So what I would do is simultaneously, as I'm doing their taking their radial artery, the radial pulse, I would just be watching their chest rise and fall and see how many times. So starting now, I'm going to start the time, 15 seconds. Okay, so that was 3 times that her chest rise. That means 3 times 4, that's 12. So that's a normal resting respiration rate. And that'll be all. Thank you so much for watching.